Yeah, you are tired. Yeah? You have had a lot on health care in Tanzania. I'm Dr. Maria Mongara. I'm coordinating public-private partnerships at the Ministry of Health and Social Welfare. So I think you have heard many from our partners who are working in Tanzania. I will go quickly on key issues. Next, please. Next. Yeah. I will just go for the key issues. What do we have in Tanzania? In the health sector, access to quality services is a problem. We have heard from partners that there is inadequate infrastructure, and also our president, JPM, you have seen through the social media and so forth, is keen on the health sector. So we have inadequate infrastructure, we have inadequate skilled healthcare providers, we have availability of unavailability of equipment, medicines and supplies, and the referral system is not functioning well. That's why you have even malaria being treated at Muhimbili National Hospital. The referral system, if it was functioning well, you could have found no malaria at Muhimbili National Hospital, because we have the primary health care from the dispensary level, health center level, and we have the district hospitals and regional referral hospitals, but they are not functioning as they are supposed to function. We have the outside health now. We have the care-seeking behavior. This is now to the communities. Care-seeking behavior, and we can see that deliveries, only 50% of women deliver in health facilities in Tanzania. And that's why we are having high maternal mortality rate of 432 women dying in every 100,000 live births. In every 100,000 live births, 432 women are dying in Tanzania. And we have inappropriate beliefs and practices which is in connection with the use of modern contraceptive methods. If it's only 27% of clients use modern family planning methods, and that's why we have also the maternal mortality being high. We have low education level, and adolescent pregnancy rate is 116 per 1,000. So we need also to start with education so that we can have these adolescents not dying or not dying of pregnancy and so forth. Next, please. Yeah. Now, having those key issues, at the Ministry of Health, we have the big results now. From 2015 to 2018 is one of the ministries where we have the big results now. And the big results now prioritized 4 key areas. If we will work in those 4 key areas, we will reduce the maternal mortality, and we will reduce a lot of mortalities in Tanzania. One of the issues is the human resource for health. You have heard from our partners that there is a problem of human resource for health. It's only 50% of the required human resource is available in Tanzania, instead of having 100. So you diasporas, what are you going to do? You have to think, and you have to help your country. And we need 100%, under the big results now, we need 100% distribution of skilled health workers when it gets to 2017, 2018. And the most hit areas is the lake zone. There are 7 regions in the lake zone where really there's a lot of a problem with human resource for health. Many would like to stay in Dar es Salaam, and many would like to go to cities, but they don't want to work in the rural areas. We have the second one, performance management. This is performance management at the health facility level. So under the big results now, we are going to rate all our health facilities. We are going to put stars like hotels. So we would like to have a health facility having from star 2 to star 3 to start with. And regardless of the owner, public or private, all are rated equally. We have health commodities. On health commodities also is a problem. That's why you find people moving from the dispensary level to the national hospital, because there is shortage of medicines and other commodities at the health facility. So under the big results now, we want 100% stock availability of essential medicines at the health facility, especially the primary healthcare facility. This is the dispensary, the health center, and the cancer hospital. We have mother and neonatal child health mortalities, and we want, this is the focus area, we want to reduce the mortality to 20% reduction in maternal mortality ratio and neonatal mortality rate in 5 regions. Again, these regions are in the lake zone. And next, please. So, after saying that, now on PPP, as the government, as the ministry, we are having public-private partnerships, and it's a policy of the government. And that's why you can see partners working with the Minister of Health and Social Welfare. We have the implementation framework for public-private partnership in place. It means we have the PPP policy of 2009, and we have the Act of 2010, and it has been reviewed in 2015. And we have the regulations of 2011, which was also revised in 2015. So the implementation framework is there. We have the health sector health guidelines on public-private partnerships since 2012. And we have the office at the Ministry of Health on public-private partnerships since we have the policy on 2009. So everything we have, what we need to do is how to work together between the public and the private sector. Again, we have the dialogue forum institutionalized since 2014. We need to strengthen partnerships with the ministry. We need to have, next please. Yeah, those are guidelines, next please. So we have the guidelines. You can have these guidelines from the Minister of Health and Social Welfare. And some of them, they are even in Kiswahili for partners who are working at the grassroots level. This will help a lot. Second, the third point I would like to stress is that in Tanzania we have, in the health sector, we have many public-private models which can be used. You have seen our partners having different models as well. So we have the contracting for service delivery, like specialized clinical services. We have social marketing for mosquito nets and condoms. We have build and transfer, that the private party will come and build a dispensary, and it will give it to the public, that is build and transfer. It will transfer the health facility to the public. We have medical training institutions, donations, capacity building, NGOs, CSOs, they are doing a lot of donations. We have heard from our partners here. They are mobilizing health commodities, and they are sending these commodities to Tanzania. Those are donations. We have accredited drug dispensing outlets, the famous known as Duka la Dawa Muhimu. We have more than 7,000 Duka la Dawa Muhimu in Tanzania, especially in the rural areas. So it is also an area of investing. If you want to invest in the healthcare, you can invest in the Duka la Dawa Muhimu. We have partnership with Lion Club, and we have corporate sector clinics. These corporate sector clinics under CRC, they are from the mines. For example, we have mines in Geita, Kahama. So out of their corporate social responsibility, they build dispensaries and some clinics. This is another model of partnership. Next, please. Now, coming to diaspora contribution in the health sector. You have heard from them what they are contributing. And what I can say here, probably I haven't taken enough, because we are working on the database to know who is doing what where. That one will help us, even when we come to these meetings, to say who is where and who is, in what area is she or he working. So we are working with the University of Dar es Salaam to create a database so that to know who are our partners. Ili tusiwe na zile NGO za mifukoni pia. Sawa jamani? Tuondoe na hizo NGO za mifukoni. So donations, capacity building, area of donations, capacity building, we have NGOs and CSOs working on it. We have like the NGO Child-Based Survival International. Yeah, provision of, they are providing medical commodities and supplies. Yeah, Taus is a focal person here on that one of Child-Based Survival International. And we have donation of medical equipment. Dr. Hadija Nyang'ani, Asha, sorry. Yes, I say that you donated a mammography to Lugalo Hospital. Yeah, it's not for me. And we have again many more programs you have heard from them. Cancer screening, cervical cancer screening. Asha Nyang'ani is mobilizing people to go to Tanzania so that they do more cervical cancer screening to women. They are working. Just some few minutes, please. So we have again specialized clinical care. I would like to recognize Dr. Semakula. He has established a dialysis center at Dar es Salaam, and now he's scaling up to Mwanza, isn't it? To Mwanza region, and I mean to Mwanza municipality. We have another dialysis center there. So we really, next please. We really thank you very much for what you are doing for the communities of Tanzania. Whether you are investing or you are working as NGO, not-for-profit, and so forth, we recognize that. Lastly, I would like just to say a few, with your permission, Chair, on investment opportunities in the health sector. We have investment opportunities in the health sector, like in commodities, medicines, and supplies. We need to manufacture some of these commodities and supplies in Tanzania. And this is the motto of our President, JPM. He wants industries in the country. So we need also to have industries in the health sector. 85% of our medical commodities are exported from outside. 85%. And that's why we are having shortages of medicines and commodities at the health facilities. Therefore, we need to have industries in the country. We urge you, diasporas, to mobilize partners to come to Tanzania so that you can have industries in medical commodities. We have again construction and rehabilitation of health facilities. We have seen that the most hit areas in the Western and the Lake Zone. Under the Mpango wa Maendeleo wa Afya ya Msingi, or Primary Healthcare Development Program of 2007 to 2017, we need to have a dispensary in every village, a health center in every ward, and a district hospital in every district. We are not faring very well, so we need you to mobilize funds so that we can construct more health facilities. Provision of modern medical equipment and maintenance, like the CT scan, MRI, X-ray machines, etc. You have had the Muhimbili saga when JPM just entered into that the CT and MRI, first of all, they are not up to date. And so we need more up-to-date modern equipment. And we thank our president that we were able to get a CT scan with his efforts. Human resource for health development for medical doctors, nurses, and paramedical graduates. We need more institutions in the country. Mobilize resources so that we can bridge that gap of 50%. And e-health interventions. E-health interventions, next please. I have already finished. Yeah, contracting and so forth. So, thank you very much. As I say, that private sector investment in the health sector is a government priority. It is a government priority. Private sector complements the government efforts. And private sector participation or involvement in the provision of health and social welfare services will facilitate achievement of the health sector vision, mission, and goal. As our colleagues are facilitating. Thank you very much for listening.
Thank you very much.
And I hope you are enjoying your lunch. I stand before you as one of the philanthropists with my colleagues here. My name is Mary Consolata Banda. I am from Tanzania, and I experienced the educational system in Tanzania until I was in high school, and then I came to the United States to go to college, and I attended medical school at Penn State University, and I specialized at Penn State University. But the journey through these educational challenges and the contrast between Tanzania and the United States is what led me to think about what I can do to affect our Tanzanians. I thought hard about the impact of change. And this was also cemented by my experience at Bugando Medical Center, where I worked with the obstetrics and gynecologists, and I saw the maternal death, the lack of medication, the lack of equipment, and has already been discussed, the need for more healthcare professionals. It was at that time where I thought, God has already given me this talent of becoming a physician. Nobody can take that away from me, but perhaps I can use my expertise to do something to help our fellow Tanzanians. You know, people say that it's only the Bill Gates and the Clinton Foundation and USAID, but I have to say, perhaps, and I think everybody in this room has created an impact in Tanzania, be it monetary or going there or paying for a child. All those are positive attributes to philanthropy. And we've listened to a lot of speakers here today. I would like to acknowledge the DICOTA for enabling us to network and hear testimonies from so many different categories. It's been a tremendous pleasure, and I thank you so much. But because I'm a physician, and I also am a teacher, I'm going to focus on the healthcare and educational system. I thought that even if I had $100, I can use that to affect more people than if I had $100 here. And the choice was Tanzania. And I can say right now in front of you all that I'm sure every one of you can change somebody in Tanzania, be it with education that you have, or monetary contribution, or even what we call in kind. If you're an engineer, or you're an accountant, or a teacher, a healthcare professional, you can go back to Tanzania and contribute your time. And as a matter of fact, the IRS gives you a tax credit for that because it's a contribution in kind. But not only because of that purpose, it's that we're blessed. We are so blessed here, and we have to sit down and think, why are other people suffering so much in the world? And what I thought I could impact is to go back. I did some research, demographics, see what the need is. And will my $100 really impact a lot of people? And the answer was yes. We have malaria. Purchasing one mosquito net is like $10. We have little kids with dehydration. Oral rehydration salts are so cheap. We have purchasing thermometers, giving them some nutritional supplies. Even the education doesn't cost money. So while people think you have to be rich to impact society, that's not the case. I decided to start an organization called Jambo Tanzania, which is a charity based on education and healthcare in the people of Tanzania. But because of how everything worked out, I had to choose an area that I can impact with less money. So I chose my parents' area in Tanzania, Kagera region. And when I went there initially, there was no school for the children. As you all know, HIV in the 1970s and 80s hit hard in the area of Kagera. These kids were orphans, and they had no school. So with $2,000 each time I got it, I was able to build 1st grade to 7th grade. Now we have over 280 people, students graduating from that school. It was something I never thought I could do. And I have to tell you, it's not like opera. I mean, it's not high class. Getting bricks and providing an area conducive for a student or a child to get their education. It was tremendous. After that, unknown to me, the government built a secondary school, and I have kids now graduating from college. Kids who are working, and I never thought that could happen. So I think we all in this room can solicit somebody, a co-worker, a friend, a family member, to just start from even your local family members. And then you can branch onto a village, and then you can branch onto an entire Tanzania. My goal was to branch onto an entire Tanzania. I started in 1998, but I quickly found out that there's so many roadblocks ahead that even if you're aspiring to contribute a lot, you might have some disadvantages and some problems along the way, but you should not give up. So from that point on, I went on to build a health center, and I've taken over 22 volunteers. They pay their own way, they pay their food, they pay their lodging, and they work for free. I've done it for the past 16 years. So what's so encouraging is that we all have a talent in this room. If it's not education, it's an art. It's the ability to speak, go talk to people, your neighbors. So elicit some of this help. It might not be monetary value, but in kind, and help our people in Africa, Tanzania, who are really struggling. And some of them, when you think of the caste system, they'll probably never make it past where they are. They need our help, and we must provide the help the best we can. Very little, too much, it's all good. So from there, I built a health center, and I've been working at that health center each time I go. Currently, I'm building a hospital. Not too big, but it's a hospital indeed. And I provide healthcare for free. But when I build this hospital, I'm going to have to charge a little bit, but it's a nominal fee, so that these people can get access to healthcare. And as we speak, I've already constructed a commercial water well that is providing underground water to the 2 schools and to the hospital and the health center, and the villagers for once in Gera will have clean water to drink. We all know the problems of dirty water, diarrhea, parasites, everything you can imagine, because they come upstream and you don't know what has passed through that water. The kids come to my clinic very sick with dehydration. We've saved a lot of children. I referred children to Bugando. One of them was taken to Italy and had his heart condition corrected. In October, I went with a neurosurgeon to Bugando Medical Center, where we operated on 8 patients who could have died. So any impact from a friend, family member, and even your colleagues, it really can go very far. Honorable Gelberg today, I listened to him. Thank you for your contributions to Tanzania, by the way. And I've listened to many other people in this room about the contributions that they've given to our country, Tanzania. It's just amazing. And I just want to say that even the Maendeleo group, I listened to them, congratulations, and many more. The work that's being done is really amazing, and for people to think that most of the diaspora are not contributing, we are, but we're doing it in different sections and in different sectors, and we're trying to expose every avenue, especially in the rural neighborhood. See, the people that suffer the most are the ones in the rural area, more so than the town people. So in this case, I'm going to also mention what Mr. Ali Mufruki said, that monetary contributions are nice, but we need to come up with sustainable projects to ensure that their kids, our kids, and the grandchildren will have facilities for healthcare and education. And that might take a lot, or it might take very little. Right now, I'm in the process of talking to a businessman. We plan to come up with some kind of either construction or production making, so that the money and the interest can enable maybe not only the village that I've impacted, but many more. Maybe someday the whole of Tanzania. It's a dream, but it's a dream that can be true. So I encourage all of you to be part of it in one way or another. I'm going to conclude by stating that it's been very humbling to help the people who are in poverty. The gratification it really creates a euphoria. You see these people bringing you little eggs and a chicken. They're very grateful for what you do, and it's very little in comparison with the money that we spend here. So please think about helping each other, think about helping the people at home, reach out to the community, reach out to your fellow colleagues, and do something for Tanzania. And I'm going to conclude by Honorable Gelbach again. He said, it doesn't matter where you reside, it matters what you do. That is powerful. So you can live in a mansion here in the United States and have everything you want. But what's your legacy? What are you going to leave behind? What have you impacted with the people of your country? It's very important for us to rethink what our priorities are and chip in. I bet you if you all have to give me $10, you wouldn't even feel it. So start that way and you move forward. Thank you very much. So now I'm going to introduce Ms. Jennifer Imani. She is representing Ms. Judith Leska, co-founder and president of Elevate a Girl Foundation, Inc. They are also a philanthropist. They were nominated for an award. So welcome, Ms. Imani.
Habari za mchana. Yeah, it's truly an honor to be here. I actually got the call about a week and a half ago, and I was stunned to represent Ms. Judith Lesika. I am Jennifer Imani. I'm the secretary for Elevate a Girl Foundation, and I wanted to share a little bit about the work we do. We're pretty new, but I'm going to tell you a lot more in the shortest time possible. We're going to have Mr. Godfrey prepare the video.
Kusoma katika kombi ya elimu kuchukua chakula science baada ya PCM ili niweze kuja engineering ndio ndio katika maisha yangu.
Huyu ni mwanangu Neema ambaye ni mtoto wa kwanza. Migoli anajitahidi katika masomo yake, lakini mimi katika uwezo wangu nashindwa jinsi ya kumsaidia ili aweze kufikia malengo. Kwa hiyo msaada huu ambao mnatoa utaweza kumsaidia kufikia malengo yake ambayo anataka kuwa.
Nafurahi sana kupata hii foundation sababu uwezo kufikia
Kweli familia yangu imeomba sana kitumia vizuri. Lakini namshukuru Mungu kwa sababu nilifika mahali nishindwa kuendeleza binti huyu.
katika upande wa ada sababu katika malezi yangu ya damu uwezo wake ni mdogo sana. Kwa hiyo nilipata nafasi ya kusomeshwa takribiwa hata katika masomo yangu advance. Nitashukuru na itanisaidia sana katika masomo yangu na kusoma dukani kwa mara zote na vile vile itanisaidia kufikisha malengo yangu kwa sababu nahitaji kufika hiyo juu na kwa dokta kwa msaada huu utanisaidia kutunza ndoto zangu na kufikia malengo yangu.
Foundation hii itanisaidia mimi katika kuendelea na masomo yangu ya kidato cha 5 na cha 6 ili nitimize malengo yangu ya
unanisaidia mimi kuendelea na masomo yangu katika kuishi yangu kama mimi nitakuja kwa engineering. Pia natamani
huyu atakuwa ni kioo cha familia, ataweza kusimama katika nafasi yake na kubadilisha fikra zingine za watu ambao hawaoni sababu ya kabisa. Nashukuru kwamba akisimama vizuri basi.
So, Elevator Girl Foundation was the dream of two people. I'm gonna go right into it. It's a 501c3 foundation, meaning your donations are tax deductible if you're here in the United States. And basically, don't look at it just as a tax write-off or a tax deductible item. You are changing lives. So two friends who happened to be my classmates in high school, back in Marian Girls High School in Bagamoyo. One who has a background in education, John Gongolo, and the other one has a background in engineering, had been talking for a while about how can we impact girls back home? How can we give back to the people who made us who we are today? And after years of talk, last year, it became a reality where they gathered up sources and decided to start up Elevate a Girl Foundation. And in the beginning, we were a bit hesitant as to, are we going to get support? And it's amazing how much you can do when you're not limited and if you keep an open heart. And shortly after that, we started getting, donors coming in, saying that they want to invest in the girls in Tanzania. So pretty much we work with underprivileged girls, and the girls that we work with have to meet two criteria. One is academic criteria. They have to show good academic record, and it's kind of hard when you're from a low-income family to actually be like top of the class. So we had to be very lenient and use continuous assessment. Basically, their track record from when they're in the Form 2, if you're familiar with Tanzanian education system, which most of you are. So we look at their Form 2 national examination results. We look at how they perform in the Form 4 exams. You can see the passion these girls have of wanting to defy all barriers that they're facing to continue their education. So we go to the candidates' homes, we interview them, we interview their families, we meet with their parents. One of our girls, as you heard in the video, she's an orphan living with her sister. And she, pretty much this is a stepping stone to the next thing. So what do we do? What we do is that these girls show good academic standing. We give them access to quality education in Tanzania. Schools like Marian Girls High School would, they will go for the interview, and then if they pass, we support them 100%. The cost of books, their tuition and fees, and the cost of education in Tanzania is expensive. So for just a regular person who's, doing like just day jobs, just gigs to get by, it's really hard to put the kids through school, like Marian Girls. So we give them the scholarships 100%, and in the event that they do not pass the entrance exam, we had to come up with a backup program. And the backup program is for the girls who pass their Form 4 exams, but they do not pass the competitive exams to the private schools. So in that case, we decided to sponsor the girls as they go through the public school. And whatever their needs are, we'll cover 100%, so that there is no limitations as they're doing their A-level exams, which is a prerequisite to go to the universities. So our candidates have to meet both criteria to be the recipient of the scholarships. And why girls, you might ask? There is a significant difference between educating girls in Tanzania. If you look at the statistics, girls are somehow marginalized. They're a marginalized group, and it's one of the initiatives for trying to break countries like Tanzania out of poverty. And the only way to do that is you give this girl an education, quality education. They, in turn, invest that into their families, back into their families, so you end up lifting one person who ends up lifting the rest of the families, and the benefits trickle down through generations. So these are our girls. We have Judith. Judith passed, actually got into Marian Girls High School, and she's very ambitious, and she wants to be an engineer. And there is Furaha. Furaha is an orphan. She lives with her sister, but she's not able to, they go through a lot of difficulties to just get to where they are right now. And there is Nema. Nema also has come from a low-income family, and she's very grateful that she'll be going to Form 5 next year. And our support will actually uplift her dream to become a doctor. And so the major thing here is, how can you help? There is one way that you can help. Monetary donations. We do need people to partner with us. Every dollar counts. If you want to change a nation, just start right where you are. And I believe this is a beautiful platform to actually activate that change. Another way you can give is actually your time. When I was told about Elevate a Girl Foundation last year, I jumped right in, and I did not want to be in the foreground. I said, I can do whatever it takes. And so I volunteered to become a secretary and, just to manage everything else in the background. So give us your time. If you have background in web design, we definitely need you. If you have background in grant writing, we definitely need you. Another way you can help us is share the word. There is 6 degrees of separation between us. Right here you met people from high school that you never expected to see. You go out there and you tell your families, tell your friends, and anything that you do is going to change a girl's life. We hope that in the next year we'll have a positive feedback. I'm a big believer that if you need to show that something is alive, you show growth. So we started off with 1 girl. We ended up having 3 in reality that we have to support this year. And who knows what number we're going to have next year. So we definitely need you. I just wanted to say thanks to Dr. Lemon Mikisha for nominating Ms. Judith Lasika. Unfortunately, she couldn't be here because of other engagements. And also the DICOTA convention and the DICOTA team and members, just for recognizing the work of philanthropists in Tanzania. You're making a difference in people's lives. People like Judith, Nema, and Furaha are forever grateful. Thank you.
Thank you, Jennifer. That was very inspiring. I forgot to mention, by the way, that all 3 of us have a website. And if you're interested, like Ms. Imani stated, to donate your time, expertise, or even travel with us and do some charity work, you're very welcome to join in. It takes a village to raise a child, and you are part of that process. I would like to introduce Ms. Tausi Swedi. She's a co-founder and country team leader for Childbirth Survival International, and she will speak about her work in the philanthropist arena, particularly with childbirth and maternal health in Tanzania. Karibu.
Asante. I don't have a voice, but I'm going to make this work. Good afternoon, Shikamoeni. I am Tausi Swedi. I am the co-founder and country team leader of Child Birth Survival International. There's a meaning in a name, and I believe there's a meaning in a title. I intentionally use country team leader because I don't want the title CEO to create a barrier when we go to countries like Tanzania, Uganda, where we serve. When people hear country team leader, they're more receptive. When they hear CEO, other things go in mind, but pretty much that's my role. I'm going to talk about Child Birth Survival International, and my first slide is I'm asking. I came all the way from Maryland to ask this for everybody for $7, and I'll tell you why in a little bit. So I have this that if you don't mind to pass around, all I'm asking for is $7. By the end of my 10 minutes, I hope I'll have $7 from everybody. All right, I'm in business, right? So I'm going to talk about diaspora philanthropy. There is nobody like a mother. There is nobody like a mother. And I think in Kiswahili, there's a word, it's the saying that says, nani kama mama, right? Am I right? Hamna mtu kama mama. Okay, they're correcting me. Okay. But there's nobody like a mother. So I'm going to talk about maternal and child health and how all of you have a role to play. Yesterday I got an award, and on it had my name, but I want to say there are 30 people behind CSI. All of them are volunteers. Some faces you might recognize, some you might not. But all these are volunteers scattered all over, in Tanzania, in Uganda, South Africa, Canada, California, Texas, and Qatar. So all those are the people who are behind CSI, giving their time, giving their skills in order to advance the mission. And that's our newest member who came today. I interviewed her, hired her on Monday. She started on Monday, and she's in Dallas, so she stopped over to say hello, so it was great to see her today. And that's her baby. CSI advocates and improves health services and information. People need services and information. Services can be available, but information is not reaching them. It's really useless. So we're advocating to push the services and the information to where these people are. The CSI vision is to grow into a reputable and trusted organization. You notice the word reputable and trusted in red, and that's very important. People have great initiatives. People want to help, but I've heard lots of stories. People need to trust. Before you give, you want to know who you're giving. Before you give, you want to make sure that your money is going to go where it's at, where this thing is going to go. And CSI pretty much does that. And I'll tell you why I'm asking for $7 again. We have partners and donors. CSI is a member of the World Health Organization. We partner with White Ribbon Alliance, Rotary International, Jakaya Kikwete Youth Park in Tanzania, and a bunch of other donors. And then we have tons of friends and friends and supporters, and that also includes people in the diaspora. We have over 20,000 people following CSI. We have the Embassy of Tanzania. I thank you so much. We have Tuzola, Voice of America, Vigimambo, and Wangu Kwanza Productions. I think those are familiar to you because they're part of the diaspora. And most importantly, I really want to thank the diaspora that's known as Bongo Yetu. Some of the members are in this room. They've been very supportive, very instrumental in CSI. That's not all of them, but they're in the room. Those are the 5 priorities for CSI. We focus on pregnant women, newborns, children, and adolescents. And when we talk of adolescents, especially the girl child, Dr. Maria Mongara spoke well. Consul spoke very well in terms of health and education is important, and those are the things we're pushing in Tanzania. At this point, you're saying, where are you guys? That's where CSI is. CSI is in Tanzania, well, the USA, Tanzania, Uganda, South Africa, Nigeria, Nepal, and India. Nigeria, Nepal, and India, we're working on those. Nigeria is in collaboration with Morgan State University. Nepal and India is a collaboration with Rotary. Where's that bag? Oh, I like that. All right, so every single day, 830 women die giving birth. 830. Many of them for causes that are preventable. In Tanzania, 35 women die every day. I want you to take a moment and think about that. Do you know the daladalas? If every single day a daladala crashed, every single day a daladala crashed and everybody died, wouldn't the government have done something by now? Yeah? They would have. Those are the number of women dying every single day, but it's business as usual. Women are dying. Every 2 minutes a woman dies giving life. The same thing with newborns as well. They die before even 24 hours of being born. We focus on adolescents and youth. The girl child remains vulnerable. We advocate for her. We support her. We also address taboo topics, especially in rural areas where girls, many of them begin menstruation and have no idea what that's all about. They're unprepared, they don't have hygiene products, so we go out to the communities, working with schools in communities, educating the girl child. Some of the pictures from what we've done, that's in Arusha. We took sanitary pads, that's at Monanyamala, that is training nurses and midwives at Temeke. That's our partner, Jakaya Youth Kikwete, giving out pads. One of the things I do as a CEO as well, I engage with potential partners. I have to meet people on the ground. I have to tell them about CSI and partner with them. That's Vodacom Foundation, and the previous one was Jakaya Kikwete Youth Park. At this point, I hope you realize you're part of the solution. Everybody in this room is a philanthropist. Everybody in this room has good intention to give, but some people don't know where to give. Some people don't know where to start. And I want you to learn more about CSI so you realize it's a good starting point. When you give us your money, we take it to where we say we're taking it. Diaspora philanthropy, we have a very special role in the diaspora. We have access, we have relationships and understand the landscape. We create opportunities for others. Through CSI, we've hired so many people in country. We give them opportunities to work and feel invested in as well. Intra-diaspora support to maximize support. That is something that I think I mentioned in terms of diaspora folks who are friends of CSI, who support the work that CSI does. CSI philanthropy have had major impact. 270 childbirth kits. So the bag has come around, so we gotta go back this way somewhere. Where's the kit? The kit is right here. So why I'm asking for $7? Because you see this kit here, and I'll pass it around. It contains every single thing a woman needs to go deliver. Women have to buy cotton, and I don't know what else they have to buy, to go deliver in a hospital. That creates a barrier for them to deliver in a hospital. We purchase these from a company in Chicago. We ship them. Where is my friend Piers? Thank you so much. He ships them all the way to Tanzania. They get delivered, and we give them to our mothers. Please pass this around so everybody understands what's in that kit. If you convert $7, that's like 14,000 Tanzania shillings. It can't even buy one quality item in that bag. That bag contains everything. The scalpel, umbilical clamps, the strings, the twist, the placenta bag, the receiving blanket, everything that a pregnant woman needs for only $7. That's a drive-through meal, right? We have distributed sanitary pads, we've reached out to primary school children, and we have also trained frontline health workers. 2016 goal, you don't see this, and really the idea was not for you to see it. The idea was for you to understand what we're trying to accomplish. We are trying to reach 1,000 women with those kits that you're gonna see. We're trying to help 1,000 women in 2016. That's a big jump from 250 to 1,000. I need everyone's support in this. We need your